In this video, we're going to talk about early onset of Meniere's disease, okay? What causes it and how we're going to take care of you. So let's backtrack. So you first noticed you've been having some problems started with what? The ears start to fill up?
Yeah, a lot of ear pressure and a lot of popping in the beginning.
Gotcha. And what about you also mentioned about tinnitus?
Yeah,
tinnitus?
The tinnitus had kind of developed, I believe, like 3 to 4 months after the first signs of like me having the ear pressure and ear popping.
Gotcha. And what about the dizziness?
In the beginning too, I had a lot of dizziness as well. It kind of made me just want to stay at home, stay in bed, and not really do much.
Gotcha. All right. So, that's the typical symptoms of Meniere's disease, all right? And then now let's talk a little more in depth. Okay. So here's the story of Meniere's disease. So we got the inner ear, all right? And we got a cranial nerve, vestibulocochlear nerve, okay? One aspect is vestibular, that means balance. Cochlear means hearing.
Yeah.
Okay. Now that's one component, right? We also have another nerve called the trigeminal nerve. Right. Now that fella, there's 3 branches of it. Comes branches off from here, here, and here. All right. So I believe you also mentioned about you've been having some teeth pain from time to time.
It feels like towards the back that I'm having pain. I don't think it's necessarily my teeth, but it feels like right where my teeth would be.
Gotcha. And so we got that aspect, right? Now, why all of this is starting to be important? Because Meniere's disease is like the perfect storm. A lot of things got to go wrong at the same time in order to get it. Now, we have a tissue on the very roof of our mouth called the soft palate.
Yeah.
Right? Now, we're supposed to have nerve function to keep that palate in place. Now, once the nerves, when we start to have traffic jams, right? And not enough nerve is going into that soft palate, the palate starts collapsing. Mm-hmm. And why is that a problem? Because we have eustachian tubes come from the ear, drains out and comes at the very top. And you fellas can actually see when you lift your lip and look in the mirror, you'll see 2 small little holes right over here. So the eustachian tubes drain right there. So if the soft palate collapses, it's basically a cave in. Okay? So it puts pressure on that eustachian tube. So we got one aspect of that fella, okay? And when the eustachian tube start clogging up, okay, in other words, start getting pinched off over here, then the inner ear can, it's now start to develop problems. Yeah. And when that starts developing problems, then that's where we start to lose a bit of a hearing, okay? Which hasn't happened on you so far, okay? But when it becomes chronic and long enough, loss of hearing is common, okay? And then we also have the balance part, because obviously, if there's fluid in there, then we start to have that little swinging, the dizziness and vertigo going on, like you're seasick. Yeah. Okay, so that's where the cochlear nerve is being, vestibulocochlear nerve is being involved in that aspect. Now, typically, what I've seen that causes that fellow over there, okay, is 2 spots. Okay, we got the lower cervical and the upper cervical. So when these 2 fellows over here, more precisely on this one over there, okay, if there's a significant inferiority, touch your head way back like this way, it can cause even more pressure into the area. It doesn't allow the region in there to properly drain right. And the atlas, if it rotates too much, okay, that's what can also cause your TMJ itself to shift out of alignment, put even more pressure on the eustachian tubes, okay? So that's what I'm saying. So there is a lot of biomechanical issues plus neurological issues to make Meniere's disease go into full blown. Yeah. All right. So that's what we're going to take a closer look at on you and the X-rays in a moment. We're going to investigate what's going on over here. But more importantly, I also want to take a look at the root cause, all the straight down here, that caused a whole entire down effect straight to the very top. Okay. As we touched base before, all right, Meniere's disease is usually some kind of biomechanical and also neurological issue around this region over here. But at the same time, I want to see what's going on in terms of how's all the structures supporting this area itself. Now, because I'm seeing we got one curvature here, another curvature over here, another over here, that tells me, okay, the whole entire spine is being rotated and twisted. Why is it doing that? Okay, so that's why we're going to take a look what's going on in the foundation itself. Now your foundation is tilting a little bit towards this way. Okay. Now another aspect is that it's very slight, but you are leaning a little bit towards the right side that way as well. So there's a slight little external rotation where your pelvis is just doing a little bit this way. So to the viewers to easily see, it's more like twist like this way, but it's just very slight. And in addition to this hip over here, the right hip is also going backwards. So since it's sinking down that way, if hypothetically, if this is the problem, right, and we address this, it's going to re-level and recenter things, right? Now, another aspect is here. Your center of gravity is way backwards. Now, the normal, okay, when we drop a plumb line, okay, should be here, not way back here. So you're basically doing it like this.
Yeah.
And there is no way you're going to walk this way. So your head, there's two gyroscopes in the head, keeps the head this way. Now you also, in addition to where your rest of your body is, you're rotating like this. So it's sort of like you're doing like the Matrix kind of thing, like this over here, right? So that's why your body starts recompensating. So even though it's going leaning way back here, your upper back over here have no choice but to go like this to keep the head level, right? So now we've got this interesting dynamic over here, okay? And in addition to, normally when we have this pelvis rotated this way, the rest of your body, the lumbars, should also follow along. But no, it did an immediate turn this way. Okay? No, it doesn't. So basically the bottom part foundation went this way, and then the rest of your lumbars went immediate opposite direction down there. So we've got one twist there, and then it anchored there, and the mid back over here twisted opposite direction, over there, and then another twist over here, another twist over here, another twist over there. So that's why we gotta address the root of the biomechanical issues. This fellow over here, I wouldn't be surprised if this fellow shows up, and we'll confirm that on you, okay? And then over here, we're gonna confirm which one of these two is in trouble. Well, most likely it's gonna be that fifth lumbar, because this is so backwards, sort of like, you know, like us screwing around on the chair, leaning on the, you know, the rear two legs of the chair.
Yeah.
So we have that issue. So by addressing those two, it may get you a little more upright, but we'll confirm that on you. And that's what I'm seeing over here. Okay, that mid dorsal over here, that's also this a compensation. That turn to subluxation, we may need to rebalance that. We do have a little minor side slip and a wedge or gap over this way, so we may need to rebalance that one as well. And taking a closer look over here, that fifth cervical really is in trouble. So we're going to confirm that on you, okay, because this is just like, as I mentioned before, you know, that rear two legs of the chair is leaning way backwards over here, and that nerve region is also for the trigeminal nerve. Okay. The second cervical over here, this is also kind of like sort of in trouble, not, okay, because the way your body compensated. That's why you don't have full-blown Meniere's disease right now. It's like partial, okay? But the inferiority is still there just a bit, just slightly tilted this way. So as in other words, because of all these biomechanical instabilities, your body kind of readapted itself. But the second cervical right over here, it's tilting. As in other words, it should be falling along like this one with the rest of the spine. But this one over here, it tilted backwards. Just very slight, but it's still there. Okay. So after we address this one over here, that one, as in other words, for this one over here, when I started realigning with the rest of your spine over here, because biomechanical, what's going to happen is that instead of being formed like where you have right here, we're going to get you a little more up right here, and then start adjusting the fifth cervical, get you a little more up here. Then this fellow over here is going to tilt even more backwards. So it's going to show up. So that's why we've got to really set that one as well. I usually don't like to mix systems for the Gonstead docs and students who are watching, but in this case, we have no choice, because if we don't, okay, that Meniere's disease is really going to flare up even more. All right. So biomechanical, this is what we're going to do. That's the battle plan. And in addition to, we also see that as well. The atlas has went interior this way, and we also see the TMJ should be here, but no, you're tilted this way. So by recentering that second cervical over here, it should help take the rotation out of that atlas on the right, and also calm down this TMJ over here, and that should open up the eustachian tubes even more, right? What we do is this. First things first, we're going to start off with inspection. We want to see where is the swelling and muscle spasms. So clearly there's a lot of puffiness up here. Okay, so your body's trying to stabilize and protect something up there. Just a little bit here, not too bad. Feel that bump over here?
Yeah.
Yeah, right? So this is puffy and swollen. Sorry about that, see?
Sorry.
We could hear it different too. So there's a lot of edematous fluid building up right underneath here. So we're gonna mark that level, okay? Okay, so we got another patch of fluid over here too. How's that fella right there?
That's not too painful, but it feels tender for sure.
Tender. Gotcha. How's this side? Not too bad?
Not too bad, no.
How's that fella? Not too
I
bad?
think, yeah, a little tender as
A
well.
little bit. Which was worse, the right side or the middle?
I feel like the middle when you press on it, yeah, more.
Yeah, bet. Okay, we'll take a closer look. So now that we identify these potential biomechanical areas and also the swellings and what have you, this device is going to help confirm the areas of inflammation. And I'm going to notate that, each level. Because in the Gonstead method, what we do is this: I want to collaborate and make sure a lot of the objective data points to the same fellows. So the more objective data point to the same fellows, it tells us, okay, we want to really take a close look because we want to make sure we're on the right fellows to correct over here. Just fine. Yeah, that's a brick wall. That's not moving. That right hip. That's not moving at all. Okay, that 2S is kind of decent. Not great, but it's decent. How's that, sir?
Doesn't really hurt. Or feel tender.
That fifth lumbar is not too happy there. Right there.
Yeah, I feel that. Yeah.
Feel that knot right there?
Yeah.
Yeah. You got another one right there too. See that? That's even much more bigger than the one below it. Right there. Feel that?
Yeah.
Yeah. That's not a happy that's cervical. How's that right there?
That's really tender.
Very tender, huh?
Yeah.
Yeah, that's the second cervical right there.
That's not kryptonite right there.
Yeah, well the atlas is kind of decent actually. Not too much swelling there. Got it. Relax, shoulder. Just relax the shoulder. There we go. A little more. Relax it a little more. A little more. There it is. Coming up, sir. Okay, go ahead. Walk up and down the hallway.
Okay.
Okay, sir. Tell me, what's different?
I mean, I don't feel. It kind of feels like a releasing, like my lower back a little bit. I don't know how to explain that. But
So low back feel releasing.
a little bit, yeah. It feels like kind of the tension is kind of like going away somewhat.
That's nice. Any differences or changes you notice in your head right now or your neck?
I don't know. I'm not too sure.
Or what about the eustachian tubes?
I'm like listening. I don't hear any ringing too much right now, but
Also, your tinnitus is getting less.
yeah. Usually my tinnitus, I can hear it more if my ears are kind of plugged. I was in the waiting room earlier and I was able to hear it just in the quiet room somewhat, but like right now I don't really notice it at all.
All right, that's good. Yeah, this lumbar gonna go. Up a little more. Yeah. Come Coming up, sir. Go ahead, walk around.
Yeah. Feels a lot of that tension going away.
Feels a lot of tension going away.
Yeah.
All right, that's good. What other changes did you notice, sir?
I mean, I can't. Oh, my neck. I'll say my neck. Right now, it doesn't feel like that soreness or like tenderness when I turn to the right, and kind of like over here.
That's good. Good.
Yeah.
What other changes you notice?
Not too sure what else. Yeah.
Okay.
I mean.
All right. No, that's good progress right there. Okay.
I think it's, similar to the rest, like kind of just, it feels like a lot of tension is kind of leaving my body. And then also, I don't know if it's mainly like the chest, but it also feels like tension is going away from my chest too.
Oh, that's right. You mentioned about that. The chest tightness and all that stuff.
Yeah, like having chest pain. They said it's I think chondritis or mitochondritis, but it's just I never had that before, and it feels good just having that kind of relief.
Good, because as we mentioned before, your whole entire spine is being twisted up.
Yeah.
So by steadily untwisting your spine, taking the pressure off the ribs, and that causes chondritis. Okay, all right, ready for the next?
Yeah.
All right, let's do it, man. Relax shoulders, a little more, Okay, we do two-parters. No, relax shoulders, relax shoulders. Okay. Here's a piece. There's one. Pump. We're gonna get some of the fluid out of the way. A little more. A little more. A little more. There it is. Come on up. Walk around, sir. Tell me what's different.
I think I'm feeling like more stability. I would think. I don't feel like, kind of like tenderness, or I guess more so like that heaviness that I usually like walk with. And then when I think the second to last time I was on here and that adjustment, it just kind of like released. Like it feels like all the pain in my neck. I can still feel it, but it feels like all that just got released.
Nice. How about the eustachian tubes?
I don't feel the ear pressure right now. I don't have the popping. Usually that's varies throughout the day. So I mean, so far, it feels okay. I feel still a little pressure here, but there's no like constant popping.
You feel any drainage right now?
Not really. Not so much drainage now.
Okay, because usually there's three scenarios. Typically what happens with the eustachian tube while it's draining. Either A, you may feel like there's like a waterfall, like really coming down, gushing down the back of your throat. B, you feel like there's like a trickle going down your throat. Okay, or C, doesn't feel anything, but you feel like you need to like cough something out of your throat. Okay, so it's usually one of those three scenarios.
I'm not too sure.
Okay, all right.
Yeah.
So, all right, let's take a look, see what's going on. All right, just relax your head. Yeah, I gotta fix this angle. Just relax, right there. Little, right? There it is. Okay, sir, walk around. So you like that, fella?
I can't tell too much difference, but I just still feel a lot of that, like that radiating pain, like kind of like releasing from my neck still.
Okay, so less radiating pain. Okay.
Yeah.
All right, so tell you what, usually in the next 36 to 48 hours, you may notice those three scenarios I mentioned before.
Yeah.
Either there's gonna be a lot of drainage, B, some drainage over there, like a tickle that back of your throat, or C, feel like you just need to cough something out. That's common in those next 48 hours, okay? So your homework is this, because it's very swollen over here, I just need you to ice over here and ice over here, all right? And then we'll see you in the next follow-up visit.
Okay.
All right?
Thank you.
Oh, you're welcome.
Yeah.
All right, sir. So give us the latest updates. How's the Meniere's coming along?
So I've noticed some changes in my tinnitus, mainly in my right ear. It seems sometimes that the frequency changes, or kind of like the pitch. There's that usual normal pitch that I've had before I came here, and then sometimes it dulls down where like I almost notice it maybe like 10%. That I can't really distinguish it. But yeah, it's been fluctuating a lot.
Good. All right, that's good progress. How's the fluid in the ears?
Sometimes I have ear pressure. It kind of comes and goes, but I don't have it like all day, or it's very kind of like minimal and rare when it comes up.
Gotcha. Okay, that's good progress right there. We'll keep at it. Okay. Thanks for the updates. It's been 1.5 years. How's all the Meniere symptoms coming along? How's the fluid in the ears, the dizziness?
So my Meniere's is doing better, a lot better. The fluid in my ears has gone down. That pressure feeling, it's almost non-existent. And the dizziness, a lot of the dizziness has calmed down since I first came here. Before, like it's so far ago, but before it was like so unmanageable that it was like kind of like bedriddening. So very thankful that a lot of those symptoms went away.
Oh, I bet. Yeah, that's not a life right there. I'm glad we were able to help you over here.
Thank you, Doc.
Oh, you're very welcome. Thanks for the updates.